Oh, what the heck was that? Oi. Yeah. Heated hatchet run-ins, bad boating practices, and lots of sword skirmishes. Today, we are headed to the 9th century Iceland, breaking down and reacting to all of the piercing medical scenes and Viking injuries from Hellblade II. Let's dive right in. Oh, a blade across the upper part of the chest. We see some blood going across. You worry about infection. You worry about potentially like tetanus exposure, making sure your tetanus vaccine is up to date. Worry about infection to the wound, and then obviously closing the wound. The dirty blades, other people's blood. So you do worry about like, could there be a bloodborne pathogen that could be transferred? Like these are like logical things. Think about what a battle scene. Big stab wound to the back going through the front. Okay, what are you worried about? What are you hitting? If you're going like midline in the back and going upward trajectory, obviously you're worrying about hitting the heart. Could a little bit of blood show up like that? Yes, maybe. It's not going to squirt horribly like that. You're going to hit the lung, so you're going to have trouble breathing. You're going to have bleeding into the lung. That's called a hemothorax. Oh. Who gets motion sickness out there where you would just be puking your brains out because you don't have the sea legs? What causes motion sickness? It's basically misinformation. What you're seeing and what you're feeling in sensation and your inner ear movement and your proprioception are just not agreeing with each other. Disorienting in the sense of it's giving you that feeling of being kind of wobbly and not right. So that's why try to focus on an object further away that's not moving. Oh, drowning injuries. You can drown literally in such a little amount of water. Two different types of drowning: wet drowning, dry drowning. Dry drowning is basically when you hit the water, you have vasospasm basically of the vocal cords in the upper airway, and it blocks any air from getting in, versus wet drowning when you're actually getting fluid within the lungs. I've had patients unfortunately come in where they've inhaled so much water that even when you try to bag them or oxygenate them, there's so much water in the way that you can't actually have gas exchange, and so then the oxygen levels are so low that it's not sustainable with life. The internal monologue. Sometimes we have people come to the emergency department where they're hearing voices, and you're always concerned about forms of psychosis where you're having command hallucinations, auditory hallucinations. There are medications that we give individuals to kind of help with that. But then the question is it your own normal internal dialogue, or is it something abnormal? You see a big laceration to the left side of the back going into the left shoulder. Obviously, it's not like the exact right color, but you'd actually see a bunch of blood coming from that in usually a couple seconds. And then you would actually be able to see the tissue move in the different layers, especially in the back. There's a lot of muscles back there. Oh. Getting stabbed right into the heart, into the lung, especially from that lower aspect. You guys know what I always say, don't pull it out. And it actually reminds me of our discount code for you guys for my supplement company, Life Happens. I don't know if anybody's been uppercutted or hit in the jaw itself from the bottom. Hurts a lot. You can lose your teeth, and then it can fracture your jaw. So if you actually fracture your jaw, you're typically going to fracture it on either side. Just depends where the energy goes out. Very rarely do you see a very isolated single fracture. The visualization of the blurriness. People come in with visual changes to the emergency department and we ask blurry vision, double vision. This would actually potentially be blurry vision versus like triple vision. And the reason we ask these weird, annoying questions has to do with different nerves of the eye versus an eye problem versus a brain problem. So we're trying to decipher the difference between those.
Is that really it? No fight left in
Wow.
Come on!
Boy. So everybody always wants to punch people in the face. Increase the risk of breaking your own hand, but again, it will rattle somebody's cage in the sense of give them a little bit of dizziness, increase the risk of fracturing their own face and causing lacerations. But face is pretty hard. Oh, got him. There's a lot of lacerations going through the protective garb, and we're seeing a lot of superficial wounds, and we're seeing a lot of blood flying. Do you see that? Hard to know. In modern day medicine, we're not seeing a lot of sword fighting injuries. We do see a lot of knife injuries, and I've seen a bunch of machete type injuries. Obviously, these are neither. Oh, See a lot of small lacerations to the shoulders, the deltoid, and to the bicep. In these moments, you know, the question ends up being, is it really affecting the functionality of the movement of the arm? Unlikely. Then you would say, okay, these are just superficial. You're not into the muscle, not causing significant amount of issues.
Grab it!
Oh, grabbing a blade with your own hand increases the risk of lacerations of not just your superficial tissue, but increases the risk of your tendons and your muscles of the hand, which may not actually allow them to function thereafter. But death versus difficulty moving your hand, I'd probably take difficulty moving my hand. So we're going left upper quadrant. What's in your left upper quadrant of the abdomen? You're right, you guessed it, it's your spleen. Unless you have situs inversus, where your organs are flipped the other side, your spleen is there. Very vascular organ, will bleed a lot. But this is going straight up through the spleen, into the lung, through the diaphragm, which is going to cause just hemothorax, pneumothorax, rupture of your diaphragm, could also hit your intestines. Oh, what the heck was that? Oi. Yeah. A little hard to see because it's dark, but I am assuming this is going directly through the neck. Anatomy-wise, if this was on a normal person, you worry about obviously your trachea and then the esophagus, and then again behind that is your cervical spinal cord. Literally, we'll do procedures that cut open this area to put a breathing tube. Similar injury on the next creature. Looks like it's either going up underneath the jaw or into the chest. But if we're going up underneath the jaw, a lot of people will actually go on a different angle, and it will go through the soft tissue underneath there. We call it submandibular area, and go into the mouth itself, causing a significant amount of bleeding, but it could go out the side and cause soft tissue damage versus going directly up into the frontal cortex, basically the front part of your brain.
We must cleanse our sins.
Oh,
Sacrifice.
no.
It is the way of the god.
This is horrible. Bad situation. But what happens when somebody gets burned? You have first degree burn, which is like a sunburn, causes a significant amount of pain. Then second degree burn, that's when you start having blistering. And then obviously third degree burn, it chars the tissue. That needs to be cut off, and new tissue needs to be given from a donor site, typically of your own body. And then fourth degree burn, which goes all the way down to different layers of tissue, all the way down to bone. This game is intense. It's got really good graphics, and I really enjoyed the incorporation of like hearing your own thoughts or voices and having different degrees of like lacerations, injuries. If you guys liked my reaction to this, let me know in the comments. And as always, do me a favor, check out this playlist right here, binge watch everything. And again, subscribe, please turn on your bell notifications and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.